Hey guys, this is Dr. T. Foster Bryant here at ScoliCare Naples in America, and we're here with Rose Mirenzi from ScoliCare Sydney. And I'm going to let her give a little more of her background. We're going to go over some questions that are important and that we get asked a lot from patients and parents coming in here. So kind of talk about your background.
So I'm a physical therapist from Australia, and I have treated a lot of scoliosis patients, and my background is in the Schroff, Leon and Cias methods, and I'm the co-developer at ScoliCare with Dr. Jeb McAvaney in the ScoliBalance program. So I'm currently Executive Director of Education and Research at ScoliCare and head up all the training and education worldwide.
Yeah, and so she's from Sydney. So for those that don't know where Sydney is, can you point that out on the map over there?
Oh, just over here.
And then we're here, so that's quite a bit away. And even though she's in Sydney, you're pretty international. You're always on the move. So talk a little bit about one of the biggest questions we have with patients come in here is, what are scoliosis specific exercise? So just explain what that really even is.
Sure. So the international guidelines provided by SOSOR, which is the International Society of Orthopedic Rehabilitation, scoliosis treatment, provide guidelines on what scoliosis specific exercises are. So to be a scoliosis specific exercise program, there are 4 components to that. You need to have 3-dimensional active self-correction because scoliosis is a 3D deformity. It is not just 2D. Then we have to take those corrections and strengthen the posture. So there has to be a strengthening component to these active self-corrections. Then from there, we have to integrate all these corrections into their activities of daily living. So whether it be soccer or their workplace, that has to all fit into their lives. And then the 4th part of that is patient education, really getting the patient to understand what it is to be able to correct themselves and how to implement it into their lives.
And is that how you make it a more sustainable, that the patient actually is they're becoming more of the rehab technician in a sense themselves instead of always having to go somewhere to get it? Do you guys see it that way? Are you trying to train the patient to know how to do their own corrections?
Absolutely. Look, at the beginning, it is difficult for the patient to be able to understand what's going on sometimes. So we do need to see them a little bit more frequently at the beginning to really get them to understand their back, what's going on, and learn what actual corrective movements need to happen for their specific scoliosis situation. But then what we're doing is looking at what they like to do in their everyday life, whether it be a particular sport or a particular instrument they like to play, and working out how we can improve their posture while they're in those positions at home. And slowly, we do get them to be able to be more self-empowered to do these exercises themselves.
So it's very specific to the case. You couldn't just give generalized exercises among a whole group of people and expect that it would be correct for those people, correct?
Absolutely, that's right. So some of the things we get asked is, why can't I just do Pilates or yoga and instead of these scoliosis specific exercises? Well, look, you can continue your Pilates and your yoga, but the problem with that is you are strengthening your body in a scoliotic position. What we try to get you to do is learn how to correct your posture according to your scoliosis situation and then implement that in your Pilates or yoga or whatever it is that you like to do. So that's right, you can't just put a one-size-fits-all approach. You need to be with someone that needs to know, that understands x-rays, understands how to analyze your posture and the situation that you're facing with your scoliosis.
Okay. So if a patient, sometimes we have patients come in where they know that they have scoliosis and they'll be sent to just general physical therapy. So kind of speak to that, because some parents, we talk to them and we say, hey, scoliosis specific exercise and general PT, very different worlds out there. It's not the same thing. Can you speak to that?
Absolutely. Look, as a physical therapist myself and having had a practice for many, many years, I can honestly say that originally I wasn't even trained in scoliosis. The first patient that walked through my door with scoliosis was a young 13-year-old, and I looked at the x-ray and the posture and recognized that I didn't actually understand what was going on. These patients do move very differently to someone who's had an ankle injury. And so what it took was for me to travel internationally and actually start to be trained in this space until it ended up that I developed the ScoliBalance program with Dr. Jeb so that we could actually tackle this in a very, very specific way. So general physical therapy is great in some situations, but in scoliosis, you really do need someone trained with expertise and who is focused on scoliosis day in and day out.
That makes sense. You know, I can speak to that too, even as a chiropractor, because and I had a fellowship through the International Chiropractic Pediatrics Association, but when I really looked at what I really knew was scoliosis when I jumped into the world, it was very minimal. It was nowhere near what I needed. So I think even in the chiropractic world, a lot of times we're very undertrained in that world coming into it, and to become a scoliosis specific, you've got to dive in and you've got to learn. There's a lot to learn. Would you agree with that?
I agree. One of my favorite things to say is that I don't think you can dabble in scoliosis. You're either all in or you're not. And I think it's really humbling when I hear other people that have, you know, not had as much training in scoliosis, but recognize that rather than just pretend they know and just continue to treat. And it's that big thing of you don't know how much you don't know until you start to dig in and find out more.
Right. And that's where, you know, over here in Scoliosis America and Scoliosis Australia, we're going to have ScoliCare facilities all around the world, but we all collaborate and share together, because uplifting the education and the knowledge is, you know, I would say we're probably the tip of the spear for that, pushing that right now. Like SOSORT, you know, being a member of SOSORT. So speak to what SOSORT is and why that's important for the scoliosis world out there right now.
Yeah, so SOSORT is an incredible society. So it was founded several years ago by some amazing doctors around the world who recognized that we had the Scoliosis Research Society, which is another great society, but it was very heavily focused on surgery. And there was no society really out there focused on non-surgical management of scoliosis. And look, we're not anti-surgery. There is definitely a place for surgery for some of the larger curves and some serious situations. But there are many, many cases where a non-surgical approach is valid. So the society started off small, and they started to look at the research that was available and dedicated their lives to researching and applying clinical knowledge to help patients with scoliosis. And that has grown to what it is today as an international society. We're both members. We've both traveled multiple times to attend the conferences, and we're dedicated to research and learning more. And I think SOSORT is just growing, and the more members that we have, the more we can help more and more people.
Yeah, and I was fortunate to be inducted last year as a SOSORT member, and I've told people many times, and the biggest thing that stood out to me was getting around doctors from all around the world, and physical therapists and physiatrists and orthotists, and you learn that the collaboration is big, and in America sometimes it's so competitive that you don't get that collaboration. So it's great to be a part of that group and come back every year and see that collectively there are some very specific people around the world that are throwing everything they can to advance, so your children and the adults and our older adults get the highest quality of scoliosis, you know, research and the results they can get. So thanks for being with us today. This is Rose. And,
thanks for having me.
We'll see you soon.